All right, so we're diving deep today, all about vasectomies.
Yeah.
You were really curious about the whole thing and sent over this Institute of Human Anatomy video, so I figured, why not unpack it together? Plus, gotta say, some of this stuff, kind of surprising. Like, did you realize how long some of these tubes are? Crazy long, actually. And get this, your body can, recycle sperm? Wild, right?
It really is.
Yeah.
We don't always stop to think about what's going on, inside us. But when you really look at the anatomy, like with a vasectomy, it can really shift your perspective.
Totally. I mean, I'm ready to have my mind blown. So where do we even start with all this?
Well, the best place to start is with the journey of the sperm. It all begins in the testes, right? That's where sperm are produced. And from there, they move into the epididymis.
Okay, wait, hold up. The epididymis, the video said that thing is 20 feet long. That's longer than my car. Why so long?
Yeah, 20 feet. It's pretty incredible. But that length, it's all about sperm maturation. You can almost think of it like a boot camp for sperm, where they spend about 2 weeks learning to swim and, figuring out how to navigate, getting ready for their big mission.
So it's not just storage. It's like sperm training grounds.
Exactly. And once they've, graduated from boot camp, they move into the vasectorens.
Ah, that's the tube that gets snipped, right? During the vasectomy. How long is that one?
About 18 inches.
Okay, so still pretty long.
It is. It travels all the way up from the epididymis through the spermatic cord into the abdominal wall, then behind the bladder, and finally it joins with the urethra right in the prostate gland, which, by the way, produces fluid that nourishes and protects those sperm.
Right. So that's where it all, comes together before heading out through the urethra. It's just amazing how everything is connected, But going back to the vas deferens, how did the sperm even move along that path? It seems like a long way to go.
Well, the walls of the vas deferens are made of smooth muscle, and that muscle contracts. And that's what propels the sperm forward, especially when someone's aroused. It's like a biological pipeline, with these muscle contractions pushing those swimmers along.
Okay, so let's talk about the actual vasectomy procedure. The video mentioned a couple of ways to do it. The conventional and the no-scalpel. What's the difference?
The main difference is in how the surgeon gets to the vas deferens. With the conventional vasectomy, they make a small incision, in the scrotum. But with no scalpel, well, just like the name says, it's a tiny puncture, not a full incision. They both aim to isolate the vas deferens, but no scalpel tends to be the preferred method.
Yeah, less invasive, less pain. Makes sense. So what happens once they have the vas deferens isolated?
So then they remove a small section of the tube, usually about 10 to 15 centimeters. And after that, they seal both ends using cauterization, basically heat. That creates a barrier so sperm can't get through.
So it's like a roadblock.
Yeah.
On the sperm highway.
Exactly. A roadblock for sperm. And to make extra sure those sperms stay put, surgeons will often do something called fascial interposition.
Fascial interposition.
Yeah.
Sounds intense. What's that all about?
So think of it like adding an extra layer of security. Fascia is this connective tissue. It's found all over your body. It's tough and fibrous. So during the vasectomy, they'll take a small piece of fascia from somewhere nearby and place it over the end of the vas deferens, the end leading to the urethra. It's basically like a second barrier.
So double bagging the sperm just to be safe.
Yeah.
And after the procedure, I'm guessing it's all about keeping comfortable.
Exactly. They close the incision or the puncture, with stitches or surgical glue. And you'll probably need to wear some supportive underwear. Ice packs help with the swelling and, of course, pain medication. It's all about making sure you're comfortable and healing well.
But even after all that, the video said it takes, 3 months to be completely, in the clear?
Right. It does take time for all the remaining sperm to clear out of the vasectoms, even after the vasectomy is done. That's why it's really important to use other forms of contraception for about 3 months. It's not, an instant thing.
Not like flipping a switch.
Gotcha.
So how effective are vasectomies as far as contraception goes?
It's considered one of the most effective methods, actually. Success rate's over 99%. But of course, with any medical procedure, there are always potential complications. We can talk more about those in a bit.
Yeah, 99% sounds pretty good to me. But before we get to the complications, I've always wondered, what happens to all the sperm after vasectomy? The testes are still making millions of sperm every day, right? Where do they all go?
Yeah, that's the question, isn't it? It's a fascinating process, actually, called sperm degeneration and reabsorption.
Reabsorption. So my body, recycles the sperm.
Exactly. Inside the epididymis, there are these special cells with these tiny finger-like projections called microvilli, and they increase the surface area of the cells, making them really good at absorbing the sperm as they break down.
Wow. So my body has its own, like, waste management system. And this isn't just after a vasectomy. It happens all the time.
That's right. It's happening all the time, regardless of whether you've had a vasectomy. So no worries about a buildup of sperm, causing any problems. That's just a myth.
Well, good to know. Bodies are pretty amazing. I mean, we've already learned so much from, like, the anatomy of sperm, the procedure itself, even busted a myth. But before we move on to pros and cons, what's, like, the biggest thing that stands out to you about all this?
It's amazing, isn't it? The level of detail, and something we usually don't even think about. Makes you really appreciate how complex the human body is, how everything is, like, interconnected.
Yeah, it's not just a simple snip of vasectomy. It's so much more to it.
Absolutely. And I think understanding that can help people make, better decisions about their reproductive health.
Well said. All right, so let's move on to the pros and cons. I know the video mentioned some key points. What are some of the advantages of getting a vasectomy?
Well, one of the biggest benefits is, cost effectiveness, especially if you think about it as a one-time procedure. Compared to, years of birth control or other methods, it can save you a lot of money over time. And another big one, a vasectomy doesn't mess with your hormone levels.
So no hormonal side effects. That's a huge plus. But there's got to be some downsides too, right?
Of course. While it's rare, there can be complications like infection or bleeding. And there's something called post-vasectomy pain syndrome, which can be chronic pain in the testicles or scrotum.
Ooh, yeah, that doesn't sound fun. How often does that happen?
Very often, thankfully.
Yeah.
It's a small percentage of men who get vasectomies. Not really sure what causes it exactly, but they think it could be nerve damage or maybe inflammation. The good news is there are treatments to manage the pain.
Okay, that's good to know. But what about the big one? Reversibility. Like, what if someone gets a vasectomy and later changes their mind about kids?
Yeah, that's a big one. And definitely something to think about carefully before opting for a vasectomy. Vasectomy reversal is possible, but it's a lot more complicated than the discectomy itself.
I bet. That vis deferens is a pretty tiny tube, right?
Exactly. They actually have to use microsurgery to reconnect the severed ends. It's pretty delicate, needs a surgeon with, special training and expertise.
So, not something to be taken lightly. What are the chances of success with a reversal?
It really depends on a few things, actually. The type of vasectomy that was done originally, how skilled the surgeon is, and probably the biggest factor is how much time has passed since the vasectomy. Generally, the longer it's been, the lower the success rate.
So it's not like hitting undo, really. Sounds like the decision to get a vasectomy should be made knowing it could be permanent.
Absolutely. You have to think long-term and, consider all the possibilities and talk with your partner, of course, and your doctor to weigh all the pros and cons.
Informed decision-making, right? Making sure you have all the info and are comfortable with, whatever might happen. Thinking about all this makes me think about all the expectations around family planning and how we assume it's the woman's, primary responsibility.
That's a really good point. I mean, vasectomies show how men can, take a more active and informed role in those decisions. It's about sharing that responsibility, recognizing that both partners have options.
I agree. It's about, changing those old norms and having a more balanced approach to reproductive health. But going back to the procedure, I'm still kind of stuck on what happens to all that sperm after a vasectomy. You explained the reabsorption, but, does that mean there's no sperm at all in the ejaculate?
Yep, that's right. After a vasectomy, there's no sperm in the ejaculate. Because remember, the vas deferens, the one that carries the sperm, that's been interrupted.
So the volumes may be a little less, but everything else is pretty much the same.
Pretty much. The fluids from the prostate and the seminal vesicles, they still contribute, so the volume doesn't change much.
Makes sense. It's wild how much we're learning about something that's, often kind of hush-hush. It's great to have this information and to talk about it openly.
For sure, knowledge is power, right? And when we're talking about our bodies and reproductive health, that knowledge helps us make the best choices for us. And, we've only scratched the surface here. The male reproductive system is super complex.
True. So much more to explore. But I think we covered a lot of the basics about vasectomies today. From the anatomy to the procedure, even, what happens to those little swimmers afterwards.
We did. And I hope all this information, helps you have better conversations about reproductive health. And maybe even advocate for shared responsibility in family planning.
Yeah.
Breaking down those old stigmas and having open dialogues.
Absolutely. It's time to move past those old assumptions and, be more inclusive and equitable when it comes to reproductive health.
Well said. And remember, there's always more to learn. There are great resources out there, like that Institute of Human Anatomy YouTube channel. Super engaging and easy to understand.
That's a great reminder. I mean, we have all these amazing resources available, and it's up to us to be curious and learn so we can make the best choices for ourselves.
Couldn't agree more. Curiosity is key. And with that curiosity, we can keep on learning about this incredible world, inside our own bodies.
So true. But before we get lost in the amazingness of the human body, let's bring this back to you and your situation. You mentioned, looking into long-term family planning options. So how does this new knowledge about vasectomies fit into your overall plans and goals?
That's a great question. Now that we've really gone deep on vasectomies, let's see how this all fits in. What are you thinking?
Okay, so right before I got us sidetracked talking about sperm, we were about to get into the pros and cons of vasectomies. You were saying cost effectiveness and no hormones are big wins.
Exactly. And another good thing is a vasectomy won't affect your blood supply or your nerves or even your testosterone levels. Everything keeps working normally in those departments.
That's good to know. What about the downsides, aside from the initial discomfort? Got to be some other things to think about.
Of course. Complications can happen like infection or bleeding, although it's pretty rare. And then there's post-vasectomy pain syndrome, which is basically chronic pain in the testicles or scrotum.
Ouch, that doesn't sound good. How common is that, though?
It's not common, thankfully. Just a small percentage of men who get vasectomies experience it. They're not totally sure what causes it. Could be nerve damage or maybe inflammation. But there are treatments to manage the pain, at least.
Okay, good to know. But what about the big question? Reversibility. What if you get a vasectomy and then, down the road you change your mind about wanting kids?
Yeah, that's a big one. Definitely something to think about seriously before getting a vasectomy. A vasectomy reversal can be done, but it's a lot more complicated than the vasectomy itself.
Yeah, I bet. The vasectomy is so tiny, right?
Exactly. To reverse it, they have to use microsurgery to, reconnect those severed ends. It's a super delicate procedure, and the surgeon needs special training and a lot of expertise.
Definitely not something to take lightly. So what are the chances of success if you do a reversal?
Well, it kind of depends on a few things, like what kind of vasectomy you had originally, how skilled the surgeon is, and probably most importantly, how long it's been since you had the vasectomy. Generally, the longer it's been, the less likely the reversal is to be successful.
So it's not as easy as hitting undo. It sounds like if you're going to get a vasectomy, you got to go into it knowing it might be permanent.
You do. You got to be thinking long term, what if? And talk to your partner, for sure, and your doctor. Weigh all the options.
Make an informed decision, right? Make sure you have all the facts and you're comfortable with what could happen. This whole conversation has really got me thinking about family planning and how we just sort of assume it's the woman's main responsibility,
That's a good point. I mean, vasectomies really highlight that men can and should take a more active role in family planning decisions. It's about sharing that responsibility and recognizing that both partners have options.
Totally. It's about changing those old ways of thinking and having a more balanced approach to, reproductive health overall.
But going back to the actual procedure, I'm still wondering about what happens to all the sperm, after the vasectomy. You mentioned the reabsorption thing, but so does that mean there's absolutely zero sperm in the ejaculate?
That's right. After a vasectomy, there's no sperm in the ejaculate. Because remember, the vas efferens, the one that carries the sperm, well, it's been cut. So the volume is maybe a little less, but otherwise everything is basically the same.
Basically, yeah. The prostate and the seminal vesicles, they still contribute fluid, so the volume doesn't change much overall.
Makes sense. It's amazing how much we're learning about something that's usually, not really talked about. I'm glad we're having this conversation so openly.
Me too. Knowledge is power, right? Especially when it comes to, our bodies and our health. That knowledge helps us make good decisions, ones that are right for us. And, this is really just scratching the surface. There's so much more to the male reproductive system.
So true. There's always more to learn. But I think we did a good job, covering the basics of vasectomies today. The anatomy, the procedure, even what happens to the sperm.
We did. And I hope all this info helps you, have better conversations with your partner, with your doctor, maybe advocate for shared responsibility and family planning, break down those old stigmas, have open, honest conversations.
For sure. It's time to change those outdated assumptions and, be more inclusive and equitable when it comes to reproductive health.
Well said. And this is just the beginning. There are lots of great resources out there, like that Institute of Human Anatomy on YouTube. They make it super easy to understand.
It's true. We have so many resources available these days. It's up to us to, be curious and keep learning so we can make the best choices.
Curiosity is key. And with that curiosity, we can keep learning about this incredible world, the one inside each of us.
So true. But before we get totally lost in the amazingness of the human body, let's bring it back to you and, your situation. You mentioned you were thinking about long-term family planning. So after this deep dive, how do vasectomies fit into your overall plans?
Yeah, that's the question, isn't it? Now that we've really dug into vasectomies, how does it all fit in? What are your thoughts?
It's really interesting how this conversation has kind of gone beyond just, the how-to of a vasectomy. We're talking about, like, communication and responsibility in relationships, even societal norms.
Yeah, it shows that medical decisions, they're not just about biology. They're tied to our values, our relationships, the whole social context.
Exactly. And I think that's what makes all this info so valuable.
Yeah.
Right? It's not just the facts, it's how those facts affect our lives, our choices. So let's bring it back to you. What are you thinking now after all this?
It's a lot to process, honestly. Before this, a vasectomy was like this abstract thing, but now I have a much better idea of what it actually is, physically and emotionally.
Yeah, I get that. Reading about it is one thing, but when you really dig into the details, it hits different.
Totally. And I really appreciate you bringing up the part about talking to my partner, really openly and honestly. It's not just my decision, it's ours.
100%. And those conversations, they can be about more than just the procedure itself. It's a chance to talk about your values, your goals for your family, and, how this fits into your future together.
I'm also realizing that I might have some anxieties about this, some societal pressures I haven't really thought about. Like, what does it mean to be a man if you choose to do something that affects your ability to have kids?
Those are important questions to ask yourself.
Thanks.
And it's totally normal to feel that way. I think it's so important to, unpack those expectations, those assumptions we all have about men and, their role in reproductive health.
It's funny because the more I learn about the male reproductive system, the more I realize how little I actually knew. Like, we're taught to think of it as this simple thing, but it's so much more than that.
You're right. And not knowing can lead to like misconceptions, and it keeps guys from, being a part of these conversations.
I'm starting to see how knowing more can be empowering, It gives me a sense of control and lets me make decisions that feel right for me, for my partner.
That's what it's all about. Knowledge is power, right? It takes away the mystery and lets us take control of our own bodies, our own health. So as we wrap up this deep dive, what are some of the key takeaways for you?
Definitely the part about communication, talking with my partner honestly and respectfully about what we want, what we're worried about, what this means for us.
I love that. Communication is so important, especially for big decisions like this.
And I have a new appreciation for how complex the male reproductive system is. It's not just a simple on-off switch.
Right. And knowing that can help break down those stereotypes and make room for guys to, be a part of family planning decisions.
Exactly. It's about moving past those old expectations and having, a more informed and equal approach to reproductive health.
So well said. And remember, this deep dive is like just the start. There's always more to learn. So keep asking questions, keep learning, keep those conversations going.
I will. Thanks for, guiding me through this. It's been really helpful.
My pleasure. And hey, you're not alone in this. There are tons of resources out there to support you. Keep exploring, keep learning, and stay curious.